welcome back to my channel Dr. Pooja's Yoga. I am Dr. Pooja Sharma. Today I will be busting 5 myths about IVF. So what is an IVF? IVF is a type of assisted reproductive technology in which eggs are retrieved from women's ovaries and are then artificially combined with sperm in lab for fertilization. So people who go for IVF for some reasons, some of them are for endometriosis, having PCOD or bilateral blocked tubes or uterine fibroids. So what are the myths and misconceptions that we think that an IVF process have? So 5 myths that I will be busting today. So first myth is IVF always leads to multiple pregnancy. No, this is not a true statement that IVF is always leads to multiple pregnancy. These cases were reported when there were practices of transferring more than one embryo at a time in an IVF cycle. But there is an amendment in Act now. There is only one healthy embryo will be transferred in an IVF cycle. So myth number 2, IVF baby is abnormal baby. No, there is no risk in IVF babies like this. The persons who are going for an IVF treatment is not a true relation between abnormal babies and IVF. There are 4% chances of genetic and congenital disease for major birth defect in babies as in natural pregnancies also. And myth number 3, IVF failure can spoil your chance of success forever. No, if your one cycle is failed due to some reasons, there is no such relation that you will never get pregnant. There have been many cases in which 4 to 5 chances they get they negative, but after that there is a success in their cases. So there is no such true relation that you can't get pregnant if you fail a single or 2 or 3 cycles. And myth number 4, IVF can lead to a hormonal imbalance in later life. No, there are some side effects of such medications, but it depends on individuals. There is no such relation that it will lead to an hormonal imbalance in later life. It's your whole body defense that you are suffering or having side effect after IVF. It's your whole body defense, and there is no such relation to every person who is going for an IVF that he will get hormonal imbalance. And fifth one is the IVF pregnancy means delivery through C-section. No, cesarean section is required or is suggested in cases when there is an individual complications, or it depends on persons to persons. There is no such relation that IVF always leads to an cesarean section. Is IVF is safe? Yes. People who go under IVF experience no health problems in their pregnancies and in their deliveries. So if you are having an IVF treatment, so don't worry. These are the myths that I want to bust, because being an IVF counselor, I want to tell you that risk and success, it depends on person to person. So thank you for watching.